Hello and welcome to episode 79 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is perfect hip mobility to resolve lower back pain. If you have not joined our private Facebook group yet, RehabFix Low Back Program, you need to go join it so that you can get immersed in a community of people who are invested in resolving the lower back issues, so that you can get our free sciatica guide, and so that you can get direct access to me and exclusive content that I post on there that I do not post anywhere else. If you're serious about your lower back issues, well, if you're really serious, you would have just already sent me a message by now to help you resolve it and to give you a plan. But if you're pretty serious, then you will join the Facebook group and get involved and prove it. So today's topic is all about hip mobility. Hip mobility, how it relates to low back issues, some great hip mobility movements you can do today so that you can improve your function, improve your stiffness, improve your restrictions, and improve your low back function entirely. So first off, a quick analogy I like to use, okay? If you got tight hips, it's kind of like squatting in tight jeans that don't stretch, okay? Imagine you're trying to squat. Most people are wearing leggings or nice stretchy shorts so that their clothing is not in the way. Now imagine you put on a nice tight pair of jeans. You know, that pair you had growing up that were kind of lighter colored as well. Lighter colored, almost felt like rough on the inside, right? Like slightly sandpapery. And if you tried to bend over in those things, they were not moving, right? Try to squat in those guys. Not happening. Your hips are not going to move. And a lot of the force is going to go into your lower back. Okay, this can be a common compensation for many people. And you want your hips to be free because the best athletes in the world know how to move through their hips effectively. They know how to move through their hips effectively. So we want you to have excellent hip function, both with mobility, stability, control. These are things that we take our clients through in our program. Everyone with low back issues needs to perfect their hips. So we help individuals perfect their hips throughout our program while they're on their journey to living a back pain and sciatica-free life. So one classic one, I'm going to go over a few different ones, okay? One classic one a lot of you have seen me post is the 90-90 transition. Now, so many people when they get in this position, for those of you who don't know what this is yet, this is essentially when you're sitting on the floor. You're putting one leg at a 90-degree angle in front of you and the other 90-degree angle behind you. You have a 90-degree angle at your groin and at your knees. Okay? And some people have a hard time just sitting in this position, and that's okay. And then we transition one way at a time. But here's the way you want to perfect this transition. Okay, for those of you who understand this exercise, you'll be able to visualize it pretty well. Okay, for those of you who aren't sure, type in 90-90 hip mobility or 90-90 transition hip mobility. Look that up, and then what I say is going to make a lot more sense. So when you're in this position and you're going to rotate to the other way, let's say my left leg is forward. Okay, let's say my left leg is forward, my right leg is back. When I go, I'm going to lift my right knee first. I'm going to lift my right knee as far as I can possibly open it before I follow through with my other leg, because I want to maximize the end range of each individual joint. If I get in this 90-90 position and I just quickly flow back and forth, it's not going to get me very much out of it. It's not intentional. You're not going to be pushing the joint to its end range. You're not going to be maximally stimulating those mechanoreceptors and synovial fluid production and all that fun stuff that you want to get out of mobility work. You're not going to get that if you're rushing it. So once again, left leg forward, right leg back. You're going to lift the right knee first, open it as much as you can, and then sit nice and tall, following through. And then when you get ready to transition to the other side, now lower that, originally the front leg, so the left in this situation, lower that left knee to the ground first before you transition the rest. So you're basically doing one knee at a time, okay? This is a great way to get the most amount of motion through your hip, the most amount of stimulation through it as well. Additionally, that is, one classic hip mobility movement. Another one I really like is hip CARS, C-A-R-S, CARS, hip CARS. It stands for hip controlled articular rotations. This is also going to load your joint in those ranges of motion that you just opened up from doing the 90-90 the right way. Now, by doing hip cars, you can look this up on YouTube as well, you will be able to load the joint in all of those areas that you just cleared out so that your body will be able to adapt to that new range and it'll last longer. Your mobility will be more permanent, especially if you keep these things in your routine. What is hip cars? Hip cars is basically really slowly taking your hip through a big circle one way and then a big circle the opposite direction, maximally going to the end range, pushing your hip, stimulating your joint excessively. Okay, it's a great way to load these joints, to keep them fresh, to keep them healthy. Definitely loading them after you're opening them up and giving the ability to do so. Okay. Another really good hip mobility movement that you can do is actually some hip flexor work. A lot of people think, oh, I'm sitting at work all day. My tight hip flexors, I need to stretch them. I wouldn't really. I mean, sure, you can stretch them a little bit if that feels good, but I would strengthen them, man. You're not using them enough. You're not using those guys, so I would strengthen them. And one really good way you can strengthen your hip flexors and feel really, really good release is by two ways. If you want to get a forearm workout too, you can get a kettlebell. You can hang from a bar. You could hook your foot in the kettlebell and then raise one leg at a time, like you're doing a hip flexor raise or a high knee. Okay, while you have that weight on board. And that is going to destroy your core in a good way, and that's going to destroy your hip flexor in a good way. Okay, that's one way. Or you can grab a band, lay on your back, wrap that band around both of your feet, and then kick one foot away from the other at a time. So you're using the glute on one leg, the hip flexor on the other to maintain that position. Okay? It's a really simple way to load the hips, load the hip flexor, and improve some mobility through the hip flexor region. One other movement I really like is the frog stretch. The frog stretch is fantastic for opening up the hips into abduction, specifically for preparation for a sumo deadlift, which I do a lot of sumo deadlifts, so that really helps me get really good positioning in that. And then once again, loading the adductors. The Copenhagen plank. The Copenhagen plank was used to reduce groin injuries in a lot of athletes, such as soccer, and football players, and athletes who have a common trend of groin injury. The Copenhagen plank was found to reduce groin injuries. But it's just a great way to load the adductors as a whole. And I actually find that a lot of our clients, after we talk them through doing Copenhagen planks, they actually get more mobility through those adductor regions. They get more mobility, the hip gets stronger. It's a win-win in all areas. So that is a great resource to use for improving both your mobility and your hip stability and core stability at the exact same time. The Copenhagen plank is definitely a game changer. It's a big deal movement, we'll say. Okay. But the biggest piece here I want to emphasize is that there's a lot of different hip mobility movements, but you need to go to the end range on them. Okay. Take the joint as far as it will go. Don't just grab your knee and pull to your chest and say, there, I went all the way. You got to actively use your hip. Actively use it. Don't just passively stretch it. Actively use it and push into the end range. One thing I'll do sometimes is I call them liftoffs. In that 90-90 position, whichever leg is back, once again, let's say the left leg is forward, right leg is back. I'm staying tall, looking towards my front leg, my left leg. Then with my right leg, what I'll do is I'll keep my foot on the ground and I'll lift my knee as far as it'll go. And I'll push at the top and I'll lower it down. I'll lift it again, push at the top and I'll lower it down. Then I'll do the opposite. Push the knee down, lift the foot. Push, lower. Knee goes down, foot goes up, push, lower. I'm loading my joint and my muscles in the end range. This is an extremely important range to hit because you rarely hit the end range. Most joints in your body you are not taking to the end range on a daily, weekly, monthly, or even yearly basis. And the more you take your joints to end range, once again, the more nutrients they will get, the more synovial fluid will be produced, the more mechanoreceptors will be stimulated. You will gain better proprioceptive control over these regions, which will reduce pain thresholds, which will improve your function and performance. These things are crucial to having healthy joints and healthy movement as a whole. So take those hips to end range. Do not be afraid to take them to end range. That is why I really like the 90-90 transition in the way that I described and the hip cars movement. These are what I would call essential. I promise the reason for your hip being stiff is not your psoas, okay? I promise it's not that. The psoas is early 90s, or not early 90s, early 2000s kind of dogma BS where it's like, oh my gosh, we found the cure for all back pain. It's the psoas. It got a whole lot of popularity. Still hasn't died down yet, unfortunately. So it's not your psoas, I promise. Something else is the reason for your hip stiffness or your lower back pain. It is not your psoas, I promise you. But what I do before my workouts is I do the 90-90 transition. I do go about 5 times each direction. So going back and forth, 1, 1, 2, 2, going back and forth. After I do my hip mobility work, I will load my hips. Okay? I will load my hips. I will do some of our glute med stability work that I have in our program for our clients. Okay? Also, there are other glute and hip stability movements you could do, just maybe not as good as some of our more clinical ones that you can just do on the ground without any equipment. A lot of people will go to like abductors at the gym or something like that. It's just not exactly the same. So one thing you could do is like banded clamshells. Banded clamshells would be great. Do a split squat and perform a feed the mistake mechanism. So what I mean is that forward knee, grab a band, pull it so that it pulls the knee in. Fight against it. Pull the knee out. So you're resisting the band. That'll get your glute activated in a more kind of dynamic movement to really train you how to keep that knee and glute engaged while you're exercising or doing lunges in that particular example. So loading the glutes after mobilizing them will help the changes last, and it will actually improve the function of your hips even more. So that's a quick, fast, down and dirty discussion about hip mobility and why, if you're not putting an emphasis on your hip mobility, you need to do it. You need to do it now because it's extremely important for your current health and for your later health and for your lower back health and for everything. So get started on your hips, care about your hips, show them some love. Let's get them where they want to be. And as always, if you want help working on your hips or your low back or your sciatica issues, then please submit an application using the page on our website or the link in the description notes of this podcast. And I would be honored to help you one-on-one figure out what you can do for yourself and the step-by-step guide that you are missing that could get you pain-free extremely fast without pills, injections, or surgery. If you are watching on YouTube, please like, comment, and subscribe. If you're listening on your favorite podcast platform, please leave a 5-star rating and review. It is a free way to help grow the podcast, to help support me, and help this podcast reach more people so that we can help others find the relief that they deserve after years without answers, after years without results. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.